mean, wow, that session on families. I mean, so many threats and complexities, and also quite a heavy one. But it was good to hear about all the things that can help families as well.
Yeah, most definitely, the graft. It was so interesting to hear about the efforts to measure well-being. It does make sense that we have to measure what's important to us if we're going to keep track of progress. And it also helps for us to hold our leaders accountable for the commitments that they're making. But now we have some really interesting core sessions coming up. One is about food. I know that's a big topic. Many people interested in that. And it's called Hungry for Change. Students assess school nutrition programs. The other is a really hot topic as well, and it's called Man Up. How deconstructing masculinities improves adolescent well-being, because we need to empower boys, but we need to deconstruct harmful masculinities too.
That sounds brilliant. So, guys, we'll see you again soon.
For 1.8 billion young hearts, we are one.
Poverty, violence, and abuse can increase the vulnerability of adolescents to mental health problems. UNICEF Belarus has developed a unique platform that creates a real-time interaction between adolescents with psychological care providers, as well as among other peers. In the Read section, adolescents can receive reliable information about mental health, well-being, and most common issues. The Play section provides games that help to build coping skills. This platform also provides information for parents who want to learn about adolescents' development. The counseling can take place through messenger, video, or audio communication. All counseling sessions follow specially designed protocol. The importance of the mental health of adolescents is now our top priority at the regional and country level. This platform provides an array of opportunities for adolescents to strengthen their mental health awareness and well-being, while also not being alone when support is needed. We believe that no one should be left without psychological support in difficult moments.
We are here at the United Nations in Geneva getting your voices heard, and that's on period.
1.8 billion!
So to you, the 1.8 billion young people, keep making your voices heard.
I want to see governments investing more in the rural areas, the primary healthcare in those rural areas.
On the 1.8 billion campaign, we're with you, and we will do everything to support and make sure that the campaign is a success.
So, Youth Council, what do? We basically ask for one thing: young people as equal partners on decision-making tables.
PMNCH is here in Bahrain at the 146th IPU Assembly to share with the parliamentarians the 1.8 billion campaign for adolescent well-being.
I am supporting the 1.8 billion campaign.
Yo apoyo a los jóvenes. Para mí es muy importante el futuro para los jóvenes.
We really need to drive the gender-responsive solutions to, tackle all the challenges that we face.
نحن ندعم المليار و800 شخص من أجل تعزيز صحة الشباب والنساء والمراهقين.
I support the 1.8 billion campaign because we need more young voices heard. Let's get more young voices heard.
We support the 1.8 billion campaign.
Muy buenos días, Presidenta. Un gusto poder estar con usted en esta conversación. Mi nombre es Javier Foitzik, soy estudiante de segundo año en la carrera de Derecho en la Universidad Alberto Hurtado. Y bueno.
Buenos días, yo soy Sofía Pastén, soy estudiante de Administración Pública de cuarto año de la Universidad de O'Higgins y tengo 21 años.
Encantada, muchachas.
Igual.
Presidenta, partir la conversación un poco hablando de la educación. ¿Cómo cree usted que con los avances en el mundo laboral y tecnológico ¿Cuál cree que es el rol de los jóvenes para que estén lo suficientemente preparados? ¿Cuáles son los desafíos de los sistemas educativos para que los jóvenes estén preparados en este nuevo mundo?
Yo creo que esa es una pregunta súper clave, porque en la gran mayoría de los países el problema, en los países de lo que le llaman el sur global, es decir, en países menos desarrollados, el gran tema era el acceso a la educación, incluso primaria, y por cierto, además, también la posibilidad de que los jóvenes lleguen a estudiar en la educación media y superior, ¿no es verdad? Y nosotros tuvimos en un momento una comisión que el Banco Mundial planteó justamente para mirar los avances en educación, y veíamos que se había avanzado en términos de acceso, pero que la educación continuaba siendo una educación que no se hacía cargo de lo que iban a ser los desafíos del futuro, ¿no? Claro, hay algunos avances, ¿no es verdad?, desde el punto de vista de, qué sé yo, todo el tema digital, robótica, una serie de cosas, pero la gran pregunta que existía es, los niños que estaban entrando al colegio iban a salir, no sé, 20 años después, y si eso le iba a servir para enfrentar los desafíos que hoy conocemos y los que no conocemos y que van a estar 20 años. Entonces creo que no hay una respuesta como una receta mágica, sino la necesidad de ir evaluando permanentemente los cambios y qué cambios educacionales se requieren. Mirar si los currículos son los adecuados para el tipo de cambios de futuro tecnológico, pero también si existen nuevas áreas de desarrollo en un país. Por ejemplo, dos ejemplos. Nosotros dimos gran importancia a los salacunes y jardines infantiles. Y entonces nos dimos cuenta que no había suficiente parvularias o asistentes de la educación. Entonces se generó la posibilidad de más carreras o más estudiantes y además que tuvieran empleo, ¿no? O por ejemplo, cuando decidimos ampliar lo que era la red eléctrica y había que preocuparse no solo de las fuentes de energía, sino también de la distribución, nos dimos cuenta que había algunas profesiones que no teníamos y que estaban viniendo obreros de Perú y Bolivia, estos que se suben a las torres de alta tensión, porque nosotros no teníamos eso. Y nos pasa ahora con el hidrógeno verde. Vamos a tener que revisar los perfiles de las personas que se requieren para poder generar toda esa industria del hidrógeno verde. Entonces yo diría, hay que estar permanentemente mirando el cambio, los avances tecnológicos, la innovación necesaria para también innovar la educación de los profesores, ¿no es verdad?, y por supuesto los contenidos de la educación. Y creo que eso tiene que ser un proceso bastante permanente porque hay cambios en el mundo, ¿no es verdad? Todo el tema, por ejemplo, de inteligencia artificial, que está yendo mucho más rápido que lo que los gobiernos han podido dar respuesta a eso. Entonces hay desafíos que de repente van a ser muy urgentes y donde espero que haya el tiempo para los estados para poder generar los cambios necesarios que permitan asegurar, ¿no es verdad?, una educación de calidad. Y de calidad entendiendo no solo educación de calidad en sí misma, sino también que responda a los desafíos, pero también a las oportunidades de futuro, que sean oportunidades de trabajo, ¿no?, interesantes. Y por cierto, tiene que ir de la mano de la innovación, porque todo esto es un elemento muy fundamental de la sociedad del futuro.
As we come together hand in hand, the world will witness the change we have planned. With unity and love, we will overcome. For 1.8 billion young hearts, we are one.
Hello, everyone. Good morning, good afternoon, from wherever you're joining us from. We are very excited to have you in this event. My name is Lucy Muraga. I am the Regional Technical Advisor for Adolescents and Women's Health and Nutrition at Nutrition International for the African region, and I will be your moderator for the next 1 hour or so. So on behalf of Nutrition International, the Research Consortium for School Health and Nutrition, Sight and Life, and Global Alliance for Improved Nutrition, I'd like to welcome you all to this event. We have teamed up on this session to explore the important linkages between adolescent nutrition and education. So today there are more adolescents than ever before in the world, and yet investments in adolescent nutrition remain scarce. And adolescent access to nutrition services at healthcare facilities is quite limited. We believe that access to education is a right for adolescents, and for adolescents to achieve their full academic potential, they need to be healthy and well-nourished. And this is especially important for girls, because adolescent girls are vulnerable to malnutrition due to their elevated nutritional needs, and gender inequities mean that their increased needs are not being met. And this is aggravated further when those gender norms keep them out of school. As school is one common service that adolescents are ideally accessing on a regular basis, it can be used to reach as many adolescents as possible with the important health and nutrition services like school meals, supplementation, and nutrition education, and therefore, creating quite a good safety net for this group. And this became even more apparent during COVID-19 pandemic, because this social safety net was lost as schools were closed. And this put a lot of adolescents at risk of poor nutrition, poor health, among other threats like child marriage, adolescent pregnancies, and child labor. This session will explore how research, innovative technologies, and school health and nutrition programs can promote adolescent health and well-being, improve educational outcomes, reduce gender inequities, and increase a country's economic prospects. Adolescents will also describe why nutrition matters to them, what their experiences are with the programs, and digital platforms as well. And throughout the session, we'll be asking for your thoughts through the poll function in this interactive platform, and we'll have some time at the end for questions. That said, please feel free to put your questions in the interactive platform as the session continues, and we can try and answer them either during or at the end of this session. It would also be helpful to us if you could tell us who you want to direct your question to. And with these logistics now out of the way, I will now invite our speakers for this first session. And I'd like to request our speakers to please stick to the 5 minutes that are allocated to you, and so that we have enough time in the end for questions. So to start us off, please allow me to introduce our first speaker, Gilbert Ngwane Miki, who is the founding president and CEO of Community Vision Group. He is an international development expert with over 10 years of experience, has a Master's of Arts degree in International Development, and is a PhD researcher at the University of Reading, focusing mainly on homegrown school feeding. Over to you, Mickey, for your presentation.
Hi, Lucy. Thank you very much for the amazing introduction. Just to say how privileged I am to share with the rest of the team what school meals stand to contribute to adolescent well-being. Can we have the slides on, please? Okay, I literally can't see the slides from my end, but I'll move on to say the picture we have is good for us to, first of all, understand how school meals programs were in terms of coverage prior to COVID-19. And we can actually see that school feeding programs were reaching up to 388 million children prior to COVID-19. But when COVID-19 broke out, we see that over 370 children were missing out on school meals. And not only school meals were they missing, they were also deprived of their educational opportunities. Next slide, please. Now, when we move on to understand the impact of school closures as a result of COVID-19, we see that the impact of COVID-19 also translated to poor mental health in children and young people. And we also realized that child marriages were more than double during COVID-19 pandemic, with numbers set to increase as World Vision indicated. Child labor also rose to over 160 million, and this increase was first in 2 decades. We can see that this is really a big challenge that was ushered in by COVID-19. Next slide, please. Yes, moving on, as a result of COVID-19, the importance of school meals even became more apparent, and we could see that many countries took up this as a priority, a policy orientation for their respective countries. We see the government of Finland, the government of Rwanda, and the French government, which currently sits as the chair of the Global School Meal Coalition, all ramping up efforts to see that school meals programs get scaled up to reach as many children as possible. Next slide, please. Now, let me talk a little bit about the Global School Meals Coalition, which is really an important platform where all the different countries are coming together to contribute to this bigger vision, which we see to actually how to ensure that every child has the opportunity to receive a healthy, nutritious meal in school by 2030. This important platform is working hard to restore or to improve the national school meal programs to 400 million children by 2030. And the second objective of the Global School Meal Coalition is to reach the additional 73 million most vulnerable children who were not reached previously by 2030. And finally, we're looking at the mandate of the School Meal Coalition to raise the quality of school health and nutrition programs globally by 2030. Next slide, please. This is a picture just to highlight, to tell us the momentum that the School Meal Coalition is harnessing, bringing all the different countries together. And it's important to highlight here that over 90 countries have signed up the declaration of commitment to the School Meal Coalition to actually showcase their support for the program. Next slide, please. Here, I will talk a little bit about the research consortium, where I am functioning as one of the co-chairs for diets and food system. The School Meal Coalition has the research consortium as its technical arm, which is aimed to generate the evidence that is required to showcase the importance of school meals. Launched at the London School of Hygiene and Tropical Medicine, this research consortium has a number of communities of practice, and amongst these different communities of practice, we have what we call the Early Career Researcher and Young Scientist Network, which is very important to this session as we're speaking, inviting all the young people who want to showcase their interest in school health and nutrition to be a part of this network. Next slide, please. I'll end this presentation by highlighting again on the Early Career Researchers and Young Scientists Network to say, if you are hoping to pursue a career in school health and nutrition programs, why not join our Early Career Researcher and Young Scientists Network for opportunities in research, in networking, skills coaching, mentorship. Otherwise, you can just simply stay connected to us, the research consultant, by signing up to get regular updates. Thank you very much. I will now pass you over to Keso, who will let us know why adolescents. Thank you.
Thank you so much, Gilbert. Hello, everyone. I'm Gabrielle Versutten, the Director of Science at Sight and Life, and I'm really happy to be here today to tell you about the nutrition needs and challenges in adolescence. Next slide, please. Now, as all of you know, and as we've heard many, many times during this event, there are 1.8 billion adolescents worldwide, with 90% living in lower and middle income countries. And adolescents were actually once seen as a risky age group, but now we finally recognize them as a transformative generation. Their growth not only shapes their future, but also impacts communities and nations. And as the policymakers of tomorrow, understanding and meeting their needs today is absolutely crucial. And today I want to focus on two very specific needs that they have: the need for good nutrition and the need for proper education. And in the following slides, I will demonstrate why it is so crucial to invest in their nutrition and how closely this is linked to their education. Next slide, please. Now imagine running a marathon. Each step feels like a pain, but now picture doing it with a backpack full of bricks. That's anemia. That's when your body lacks enough healthy red blood cells to carry oxygen, often due to a lack of iron. And this makes the simplest tasks feel like running a marathon with a backpack full of bricks. And iron is a bit like our unseen champion in our body. Iron is absolutely vital for creating hemoglobin, which is the oxygen-carrying protein in our blood. But when iron falls short, so does our breath, our energy, and our vigor in life's marathon. So filling the iron gap is actually the most important nutrition intervention for adolescent girls. Next slide, please. And among adolescents and globally, iron deficiency ranks among the top 10 causes of disability-adjusted life years known as DALYs. So this means that it's a big problem that can take away the fun and the active years from a young person's life, or make those years harder due to feeling weak or feeling sick. And iron deficiency, in fact, leads the charge among nutritional conditions affecting our adolescents. Next slide, please. Now, there's actually more to iron deficiency and anemia during adolescence. As you can see on the slide, during puberty, adolescents hit a growth spurt. So it shoots up in height by 15 to 20%. But it's not just height. During adolescence, we also gain a lot of weight, about half of what we'll weigh as adults. And our bones get stronger too, gaining almost 60% of their peak strength during this time. And this growth spurt it's kind of like a second chance. With the right nutrition and healthy habits, kids who didn't grow well earlier, well, they can catch up a little bit. And adolescence is a time when we lay down the foundations for our future health, relationships, jobs, parenting skills even. And while we start learning a lot when we're younger, our brains actually keep growing. And they're changing through adolescence. So adolescence is a busy time for our bodies and also our brains, setting us up for the rest of our lives. Next slide, please. And I'd like to tell you the story of Gloria, a young girl who faced anemia during her teenage years. And as you can see on the slide, anemia always made her tired, weak, and often short of breath. It also made her body weak against infections. In school, Gloria found it hard to focus. She worried about her future. What if her grades didn't improve? She might have to leave school. And facing early marriage isn't an uncommon path where she lived. So anemia also hinted at troubles for later in life, especially during pregnancy and childbirth. Next slide, please. But here's the bright turn. With the right food and iron supplements, Gloria waved goodbye to anemia. She felt stronger, her grades got better, and her future looked bright again. So Gloria's story tells us that beating anemia is about more than just getting healthy. It's about opening the doors to better education and brighter futures for young people. And with that, I'd like to hand over to my colleague from Side and Life, Jordy Fisher. Thanks so much.
Thanks, Kesso, and hello to all tuning into the Global Forum for Adolescents today. My name is Jordy Fisher, and I'm a research associate at Side and Life Foundation. I'm grateful to be with you. I'm here today to talk briefly about the most controversial meal of the day. We all know the ongoing debates and opinions about eating breakfast are nothing new, but let's explore what some very recent research has to say about this meal, specifically for adolescents in low and middle income countries. You should see two poll questions that ask about your breakfast consumption on the screen. I encourage you to complete the poll questions and even share more of your experiences or perspectives in the chat. Next slide, please. As Kesso had just mentioned, adolescence is a period of rapid growth and development for which good nutrition is necessary. The research shows that among adolescents who regularly consume breakfast, it's associated with improved school performance, overall improved diet quality, as well as a reduced risk of being overweight. Next slide. Yet, a systematic review from 2018 revealed that 40% of adolescent girls from low and middle income countries reported skipping breakfast. We also saw an age-related increase. So those that skipped breakfast were more likely in the 15 to 19 age group compared to 10 to 14. There's also regional differences. Nearly half of girls sampled in Africa are reported to skip breakfast, while the prevalence was less than 20% in areas like Latin America and Caribbean. These numbers are shocking, as breakfast skipping is a risk factor for anemia, the increased odds of anxiety, depression, and psychological distress in adolescents. Next slide. Much research has been done on children and also on adolescents in high-income countries, but our review specifically aimed to combine all the research together in a systematic review to examine the scientific evidence from LMICs on the association of breakfast habits and anthropometry and nutrition-related outcomes in adolescents aged 10 to 19. You can click. We outlined study inclusion criteria for a review, of which 44 studies met these criteria and were included, with a total population of 162,188 adolescents residing in low and middle income settings. The map that you see on the screen shows where some of these studies were conducted. We have 4 studies conducted in Iran, 4 in India, 5 in Malaysia, 3 in China, 3 in Ghana, and 9 in Brazil, with a representation mainly across Asia and Africa. Then on the right side of the screen, you see some examples of our selected outcomes that were reported on the included trials, such as weight status, hemoglobin, body mass index. Next slide. From here, we assessed the associations using meta-analyses and found that adolescents residing in low and middle income countries who regularly skip breakfast, defined as eating breakfast 0 to 2 times per week, are twice as likely to be overweight or obese than non-skippers, defined as someone who eats breakfast 5 to 7 times per week. Then if you look at the fact on the left bottom side of the screen, we assess those further. Breakfast skipping adolescents, those that sometimes skip breakfast, meaning you skip breakfast 3 to 4 times per week, are 1.3 times more likely to be overweight or obese compared to non-breakfast skippers. Then looking on the right top side of the screen, breakfast skipping adolescents were associated with a significantly greater body mass index for age compared to semi-skippers. Finally, some studies phrase questions for their questionnaire such as, did you eat breakfast on the day of this questionnaire? Yes or no? In these instances, teens who did not eat breakfast were 1.4 times more likely to be obese compared to those that did not eat breakfast on the day. Our work will continue to explore other anthropometric outcomes, such as waist circumference, but also explore nutritional outcomes like hemoglobin concentration and anemia prevalence, including investigating differences between boys and girls. Next slide. Our work makes clear from this large sample size of adolescents residing in a variety of LMIC contexts that skipping breakfast is associated with negative health outcomes, and this meal is incredibly important to live, study, and play to your full potential. Yet, it's also important to recognize that having access to a healthy and diverse breakfast may be a challenge. The reasons for taking or skipping breakfast are nuanced, just as we see in the answers to the poll questions here today, and work should continue to explore this. Building on the work already shared by the School Meal Coalition, school meal programs may provide an excellent platform to ensure healthy breakfast meals for all adolescent learners. Thank you so much for your time. I welcome any questions in the chat, and now I'll pass the floor over to Marion Roche.
Hi, everyone. Thanks so much for joining, and thanks, Jordy. Following on from considering the issues in adolescence and looking at anemia and adolescent nutrition, we're going to share with you this morning a case of taking evidence and action to create meaningful policy change for adolescents. And this is telling the stories of how WEFAS is on the essential medicines list to accelerate anemia reduction for adolescents. Next slide, please. So at the country level, when there's programs for adolescents, these are also often followed by guidelines. These are global guidelines in adolescent nutrition. And there's guidelines from UNICEF. World Health Organization has effective actions for adolescents. And World Health Organization also has an additional guideline specifically on weekly iron folic acid supplements. And all three of these guidelines, they recommend weekly iron folic acid supplements for adolescent girls to help reduce and prevent anemia. And they recommend a dose of 60 milligrams iron and 2.8 milligrams folic acid once weekly. And we'll see why this matters in the next couple of slides. Next slide, please. So this can reduce anemia by 35%. And weekly iron folic acid supplements, or WEFAS, for adolescent girls, they can reduce the risk of anemia by 35%. This can contribute to improved potential school performance, supporting cognitive development. This can be for adolescent, it can be a feeling of increased well-being, productivity, energy. And these can also be gender-responsive programs. These programs are often delivered at schools and can overcome gender barriers and highlight the gender barriers in girls' nutrition and also in school attendance. And they're also an opportunity to address that immediate gaps in the inequities that girls face in getting enough iron they need from their diets and meeting that gap with the iron supplements. Next slide. One of the challenges we found in our first 7 years of implementing adolescent nutrition programs is World Health Organization had a recommended formula for the WEFAS, but this was not available in the market. It couldn't be purchased. There were major bottlenecks to the anemia reduction efforts in countries because of this. The supplements that were being recommended for girls just weren't available. And manufacturers were unwilling to produce the WEFAS formulation because it wasn't on the model list of essential medicines. And this is a list that really influences what medicines a country procures, purchases, and produces. And countries were reluctant to support programs for adolescents when they couldn't yet purchase the supplement or the commodity that was intended for adolescents specifically. So this really created a bit of a program barrier where we had a policy recommendation, but that was not met by the supply. And the essential medicine list seemed to be the key for unlocking this. So NI really took an evidence to action approach, and we saw what was required. WEFAS had been submitted twice before to the essential medicine list, but both times had been rejected. And we realized that there was data missing on the efficacy of the products, so we conducted a randomized control trial. The other piece that WHO had suggested was a gap previously was that they needed to know that this product was acceptable and programs could feasibly be delivered to adolescents, and that adolescents would consume the supplements and wanted these products. So NI combined 7 years of program data through school-based delivery along with this randomized control trial data to show that these programs were acceptable to adolescents and could be effective in reducing anemia, as well as potentially preventing neural tube defects should an adolescent girl become pregnant. Next slide, please. So the World Health Organization model list of essential medicines. This is the key list. It's published by the World Health Organization, and it contains the medications that should be effective and safe to meet the most important needs in a health system. And this list is frequently used by countries to help them develop their own national or local list of essential medicines. It's updated every 2 years, and it's possible to submit a medication for consideration on this list. So in December of 2022, NI combined 7 years of program data along with the randomized control data and submitted WEFAS for the purpose of reducing anemia in adolescent girls and women. Next slide, please. So we are happy to share that in 2023, in July, WEFAS was added to the model list of essential medicines. And this was one of a few products specifically to meet the needs of adolescents. And it's specifically there for preventing and reducing anemia for adolescent girls and also in women. Next slide, please. So what does this mean? Having WEFAS on the model list of essential medicines, this really reaffirms that anemia in adolescents is a priority public health concern. So having the WEFAS on the list, it also signifies that the product should be available and consistently accessible in sufficient quantities in a functioning healthcare system. So this really gives acceleration to anemia reduction efforts and really shows that this is a key product that we need to make available in functioning healthcare systems, and that adolescent anemia is a priority health intervention. And at NI, this is one of the things we're committed to supporting governments to work with adolescent girls to ensure that they have access to these supplements, whether it's through school-based programs and also considering girls who may be living in vulnerable contexts outside of schools. Next slide, please. So this is just an example of taking that scientific evidence and creating meaningful action and policy change. Back over to you, Lucy.
Thank you. Thank you so much to our speakers for that engaging conversation. It is quite clear that, there's a lot that is going on in terms of what is being done in this health and nutrition space, working through the school platforms, implementing evidence-based interventions. And it is also clear that it is critical that most of these are multi-sectorally planned and implemented, and then need to ensure that they are actually being done, closely with the government. In the next session, we also want to hear from adolescents and young people about how nutrition affects their health and nutrition status, how it affects their education, and what the experiences they've had in terms of interacting with school-based interventions and also doing advocacy in this area. And to start us off, we are going to hear from girls across Africa that have participated in Nutrition International's Adolescent Nutrition Program and policy work. We asked these girls what nutrition means to them and what they feel should be done to support them better in nutrition. And this is what Esther, Nangima, and Palesa had to say about this.
Good nutrition means to me that eating variety food that gives me energy and good growth in my body. My experience in taking weekly iron and folic acid is that I have been able to do a lot of exercise. I have been strong and I have been concentrating in class whenever the teacher is in. I have been able to get good grades, especially mathematics and all the other subjects.
It is important for girls like myself to do well in school because we as girls have always been undermined that we can achieve certain things. So if we can prove to the world that we can, we will and we must. It's just an achievement for us as girls that we are able to be heard and seen by the world.
Alors si c'est une bonne question, conséquence j'aurai une bonne santé et je serai prête mentalement et physiquement pour accomplir mes rêves. Je me sens plus confiante. Je pense qu'ils doivent d'abord prendre soin de leur nutrition, regarder bien ce qu'il faut manger pour avoir une bonne santé, parce que sans la santé, on ne peut pas accomplir ses rêves, on ne peut pas réussir et du coup, la santé c'est la base.
Some of the things I'll tell my friends about nutrition is how nutrition helps us to grow well. It gives us strength in our body to play and reduces diseases in our body.
L'important de faire l'anémie pour se sentir mieux dans son corps, mieux grandir, pour ensuite servir l'humanité.
A message that I would like to give to adolescents like myself is that we should take care of ourselves. We should pay attention to what we consume, the food we eat. Yeah, I think we should just not let a peer pressure take control of what we consume, because at the end of the day, it is our lives and we have to take control and take decisions with our lives. I want to be a geologist when I grow up. So I think being well nourished would keep me focused in class and excited about everything, all energetic. So if I have those factors, I am able to strive for more in future and actually achieve what I want.
J'hésite encore entre l'architecture et la médecine, mais j'aimerais quand même être médecin.
Good nutrition will help me to become a neurosurgeon by helping my brain to develop well and to understand what the teacher is saying in class.
So thanks, Medina, for joining. Could you kindly introduce yourself and tell us your age, and what you do. What's your occupation?
My name is Madina Jubilate Kimaro. I am 19 years old and I am from Tanzania. I am a student taking business studies at Tanzania Institute of Accountancy, but also I'm a climate advocacy champion and a nutrition champion in my country.
Awesome. Could you kindly tell us a bit more about your nutrition advocacy work?
Okay, as a nutrition advocacy champion, I have been reaching out to girls in schools and girls who are out of schools and providing nutrition education to them so that they can know the importance of having good nutrition. But also in schools, I have been engaging with my peers to plant vegetable gardens so that they could have proper school menus. And in the community, I have been talking to caregivers, parents, and community members and explaining to them about nutrition education and its importance in their lives and the lives of their children.
Oh, that's great, Madina. You're doing quite a bit in your community. Can you tell us why you believe that it is important for young people, especially adolescents, to get involved in nutrition advocacy?
Okay. First, we have to understand that good nutrition is essential to having a healthy and fulfilling life. When we have good nutrition, we will be able to participate well in schools and have proper and high academic performance. And having that, we'll be able to get good jobs, which will increase our standard of living. But also having good nutrition will help us to be able to have strong and healthy body systems, and it will help in the growth and development. Also, we will not be exposed to several diseases like anemia, yes, in our bodies, and will be strong.
So how should young people and adolescents engage the government and other stakeholders in ensuring that they are, putting in place the right policies and programs for adolescents?
The government and the leaders should prioritize nutrition, and they should invest in nutrition programs. And young people taking place in those nutrition programs will help them to understand why it is important for them to prioritize having proper, balanced diets in their families. And so the role of the government is to prioritize investing in nutrition programs, and the role of young people is to take part in those programs and to spread the word to other people so as to learn more.
Clear that besides experts and governments, it's also very critical to involve young people and to include them meaningfully in these programs, and so that they're able also to spread the word about the importance of adolescent nutrition. And it's awesome to see adolescents taking charge and becoming agents in their own communities. Now, allow me to invite Eristiana Sari, who is an Adolescent Nutrition Program Associate with the Global Alliance for Improved Nutrition, GAIN. She's going to share with us some more examples of adolescents being change agents with GAIN. Over to you, Eristiana.
Okay, thank you very much. Hi, everyone. I'm Iris. So I'm a program associate for adolescent nutrition at GAIN Indonesia. And it's such an honor today. I'm thrilled to share you a project that I've been working on for a couple of years called the Food Investigator Game. So Food Investigator Game isn't just any project. It plays adolescent at its very core as a change makers. So through involving adolescents at the very beginning, we have developed a mobile app named Health Heroes Nutrihan, which is now already available in App Store and Play Store in Indonesia. I'm sure you all know, or maybe at least heard about Pokemon Go app. Yeah, so it's similar like that. So it's basically, you could imagine yourself as a Pokemon trainer in searching of a monster. So this app allows adolescents to do that just by reading and scanning food labels on packaged beverage and food items. Basically, the healthier food or beverage label item that adolescents scan, the rarer monster that they capture and collect. So we hope through this, adolescents can be engaged and alarmed to read the food labels. And most important, we also cultivated a community of vocal adolescents who are passionate about nutrition, who name themselves Health Heroes Indonesia. To date, we have 120 health heroes who've reached over 200 schools, impacting more than 60 hundreds of their peers to increase their awareness of consuming healthier food options. Not only that, we have also generated 50 ingenious ideas that have truly amazed us. So without further ado, let me introduce you to the future of nutrition advocacy, the brilliant Health Heroes Indonesia. Please play the video.
Indonesia had 64.5 million adults. That's almost a quarter of the population, where 16% of them are obese and 8.7% are underweight. Adolescents needs to be aware of the nutrition content of their food. Health Heroes Indonesia has trained adolescents to become agents of change. They campaign about building awareness that adolescents have the right to get information about what they consume.
I got the information to join Health Heroes Facilitator. I got a lot of experience.
Rapat koordinasi bareng Kemenkes dalam pembahasan Perkemenkes nomor 30 2013 tentang pencantuman tabel informasi nilai gizi.
Kita juga belajar pengenalan logo pilihan lebih sehat, klik GGL, mengkampanyekan gerakan Act for Food, Act for Change.
Health Heroes Indonesia are actively campaigning. They're sacrificing their time to campaign in schools, create petitions, and even use their own social media to build and spread awareness. Until now, there are 120 Health Heroes Indonesia have reached over 2,610 adolescents, fostering 39 ideas, mentoring the youth community, and advocating to promote the rights of young people to understand the labels in consumed food. And finally, their voices are heard. Health Heroes Indonesia are involved in discussion with the Ministry of Health of Indonesia regarding the inclusion of sugar, salt, and fat information on packaged foods. Not stopping there, they want to continue contributing. They aim to expand their campaign on nutrition and the environment. Through momentum of the International Youth Day 2023, it's time for the youth to be aware of green skills and sustainability. It has been 1 year, and Health Heroes Indonesia will keep fighting for a better nutrition and a sustainable world.
Health Heroes Indonesia!
Work that we can see happening with our young people, and just, reinforcing the fact that young people actually know about nutrition. They know what is good for them. They're demanding better from their communities. They have an understanding of how programs and policies should support them. So kudos to all of you. And as Keso said in her presentation earlier, this is a transformative generation. It's not a generation at risk. And we need to honor that by supporting them to grow into the policy makers of tomorrow, by listening and amplifying their voices. And now I would like to urge you to continue posting your comments, your questions, any information you have on best practices from your countries in the chat. We've gotten to that time where we have, a few minutes for a few questions. And I will start with those that I can see in the chat. We have a comment from David about the associations between skipping breakfast and obesity. And maybe I'd like to ask Jody to probably say something about this, just to give us more information on the connection or the causal connection between skipping breakfast and obesity. Jody?
Thanks, David, for this important question. There are some known reasons for why adolescents skip breakfast, but these reasons don't appear to be consistent across studies and really vary by age, by gender, by context. Yes, it is true, adolescent girls sometimes are reported for skipping breakfast to control their weight. Adolescents also report skipping breakfast because they don't feel hungry in the morning or they don't have enough time to eat food. Or food security challenges as well. But the main reasons we see reported for skipping breakfast are usually not feeling hungry, not having time, and a lack of appetite. Other reasons for breakfast skipping are not well understood, particularly those that are modifiable. So alongside assessing nutrition anthropometric outcomes, what we're doing here around breakfast skipping, I think there's definitely a need to understand the reasons for breakfast skipping, specifically among this population of adolescents residing in low and middle income countries, as these are really complex relationships, as you alluded to. I think this knowledge would help us develop appropriate social and behavior change programs and integrate breakfast into school meal programs. Thanks.
Thank you, Jody, for that response. We have another question from Malawi. How do we ensure that adolescent nutrition is prioritized? As mostly what we have seen in the past is that, a lot of the focus by government and partners is on children under 5. And as I invite Marion to respond to this question, Marion, maybe you could also take a few minutes to tell us about the poll on anemia that we ran a little earlier. Over to you, Marion.
Thanks very much, Lucy. And Ndikalo from Malawi, thanks so much for this question. I think it's something that's top of mind for all of us. You're very right that often we see a focus on under 5s and then under 2 and that 1,000 days windows in pregnant women because of those nutritional needs. But I think there's also increasing recognition that adolescence is another opportunity for growth and development, and adolescents have unmet nutritional needs that are not currently being met by health systems. I think part of the issue also that we see is often decision makers don't have access to the full story about adolescent nutrition. They often don't have data to be able to make decisions. But I think we know there's evidence-based actions that can be done right now. I think forums like this, the Global Forum for Adolescents, drawing attention to the needs of adolescents, nutrition as a part of that. Nutrition for growth, for well-being, for future economic opportunities, and for current well-being and participation of adolescents in society and school are all critical elements. I think it's not just about the effective actions, it's also about investments and accountability. I think we also need commitments and then tracking of those commitments and greater investments in adolescent nutrition. We've often seen, investments in adolescents can have up to a 10-time return over the life of an adolescent. And I think this is an amazing group to work with. Also, the energy of adolescents, they are also very much advocates for their own health and nutrition. I think we've seen that with the eloquence that the youth have spoke with today. And I think we all need to support and make sure adolescents have voice for raising these issues and hold governments, donors, and partners accountable to ensuring that we are investing in adolescent nutrition. And I think this today, hopefully there's energy coming out of today, and this is something that we keep pushing forward. And,
Thanks, Marion. You want to add something? Please go ahead.
I just wanted to mention, I think we've seen today here, there was a, in the poll, we saw very few people, know of their own anemia status. No one's taken weekly iron folic acid from we've seen in the chat. So we know there's many interventions that are effective and are not reaching adolescents. And even just adolescents having information about their own health and well-being, I think is a starting point, understanding their growth, their development, and the potential to benefit from improved nutrition. Thanks, Lucy.
Thank you, Marion. And we have another question relating to how governments can get involved in adolescent nutrition. And I'd like to invite Mickey, as he also tells us very briefly how governments can engage when it comes to the homegrown school meals coalition as one of the ways to, of course, ensure that we are providing a safety net for adolescents. Over to you, Mickey.
Thank you, Lucy. Just to mention first that there is increasing shift in priority beyond the first 1,000. Now we are talking about the first 8,000 days of life, which is really giving priority to younger people as far as nutrition is concerned. Now, how the national governments are getting involved with the homegrown school feeding program, we will see that homegrown school feeding is another kind of a paradigm shift in the safety net program, which is more transformative. This is where national governments are prioritizing the local food systems, how younger people can get connected to what is being produced within their local communities, and so on. And so we are seeing this increasing interest in shifting away from the conventional school feeding program that depends on food donations to what is being produced locally. So the deeper interest in this is not just because national government want children to feed, it's also because they want to see the smallholder farmers who initially did not have the opportunity to market their food commodities, they now have a steady, profitable market as a result of the school feeding program. And so we see national government taking interest because it is going beyond education, it's going beyond nutrition to including boosting agricultural systems and improving the local economies. Thank you.
Thank you very much, Mickey. One final question, and I think we have a few other people asking this same question. How do we engage governments to make sure that they're taking into account adolescent nutrition? Is there anyone on the floor who might want to respond to this question? How do we engage the government to ensure that they are actually taking into account adolescent nutrition in their plans and funding as well?
Yeah, Lucy, let me just come back again to say national government, just by signing up the declaration for the Global School Meal Coalition, is a step towards indicating their interest in adolescent nutrition. We can see that even in national policies, the orientation in the way governments formulate their policies is taking into consideration the aspect of school health and nutrition. But what is even more important is the upcoming Global School Meal Summit, which is trying to see how national government don't only end at signing up those declarations, but committing to them to see that they actually move from just the declarations to the action on the ground to see that something is happening. And so if you ask me, I would say a lot is happening and a lot will continue to happen for the better interest of the adolescents.
Thank you, Mickey, and thank you to all of you, our speakers and our audience for today. I think that's all we have time for. We would like to now just acknowledge, everyone who has taken time to be with us. We sincerely hope that we have made a strong case for the importance of adolescent health and nutrition and the linkage between that and school and education. Our greatest hope is that we will be able to see more investments in school-based programs that can help ensure that adolescents can get the most out of their education and meet their potential. For the adolescents listening to us, and for all of you who are doing great work in advocacy or engaging your communities in whichever way, or your governments, please keep it up. Engage with your communities, get involved in shaping these programs and policies at country level. We wish you all an enriching experience throughout the remainder of the conference. And if you'd like to know more about any of our work, please feel free to reach out. We will also be posting a lot of the conversations we've had today, so stay tuned in the platform for more information. Bye for now.